All right, so Jana, it looks like the hole in your eardrum is still here. What that means is that you're going to need to have an operation like we talked about. And the medicine for pain that we'll give you is a codeine derivative, so it's got codeine in it. And I looked up here on your electronic medical record and I looked at your pharmacogenomics profile, and it looks like you metabolize codeine normally. So that means that you don't have to worry about, just take it as directed and you should do real well. I look forward to seeing you in a couple of days and we'll get your surgery done.
Thank you, Dr. Smith.
In that scene, Dr. Smith used genetic information to determine what type of pain medication was appropriate in the postoperative period. The study how genes affect a given person's response to drugs is known as pharmacogenomics, a relatively new field that combines the science of drugs or pharmacology with human genetics, that is, the study of genes and their functions. The goal is to prescribe effective medications safely and at doses specifically tailored to a person's genetic makeup. Today, most drugs that are prescribed have dose adjustments based only on a person's weight or perhaps their body surface area, with the underlying assumption that every 80-kilogram man or 60-kilogram woman is otherwise equal. Well, this one-size-fits-all approach incorrectly assumes that a given drug works the same way and with the same degree of effectiveness in everyone. As all of us know, often from personal experience, it can be difficult to predict which patient will benefit from a medication, which patient will not respond at all, and which patient will have a negative side effect, a so-called adverse drug reaction. Adverse drug reactions are a significant cause of hospitalizations and deaths in the United States. With the knowledge gained from the Human Genome Project, researchers are learning how inherited differences in genes affect a person's response to medication. These genetic differences can be used to predict whether a given medication will be effective for a specific person. This knowledge, in turn, can help to prevent adverse drug reactions. The field of pharmacogenomics is still in its infancy, and today its use is quite limited. However, new approaches to prescribing drugs as part of personalized genomic medicine or precision medicine are being introduced into clinical practice. One such example is CYP2C19, a gene in the cytochrome P450 superfamily of enzymes. Cytochrome P450 proteins are monooxygenases that catalyze many reactions involved in drug metabolism and also in the synthesis of cholesterol, steroids, and other lipids. DNA sequence variations in CYP2C19 can influence how a person responds to drugs that are metabolized down the CYP2C19 pathway. Some variations, for example, can make a person a poor metabolizer, while other variations can make another person an ultra-rapid metabolizer. The prevalence of these different variants often follow ethnic lines. Considering, again, the example of CYP2C19, about 3 to 5% of European Americans, but up to 15 to 20% of Asian Americans are poor metabolizers with no CYP2C19 function. Lack of CYP2C19 function reduces the effectiveness of certain drugs. One example is clopidogrel, or Plavix, an orally administered antiplatelet drug that inhibits blood clot formation in persons with coronary artery disease, peripheral vascular disease, or cerebrovascular disease. Clearly, if you have one of these conditions and take clopidogrel, you certainly expect it to be working. But if you have CYP2C19 variants that make you a poor metabolizer, clopidogrel does not work, and you have an increased risk of a heart attack or a stroke. Today, at UIHC, healthcare providers can order CYP2C19 testing. And there is no doubt that in the future, when your healthcare provider prescribes a medication for you, whether for pain control after a surgical procedure or perhaps as a blood thinner, pharmacogenomics will be standard medical practice, and your genomic DNA will be considered as your prescription is written to ensure that you receive a medication and a dosage appropriate for you. If you're interested in learning more about pharmacogenomics, please contact the Iowa Institute of Human Genetics.